A couple years ago, when I found out myself I was diagnosed with Hodgkin's lymphoma, the first thing I said was, "What is that?" That was often the same question I got when I told others. Nobody knew, including myself, what it was. Unlike breast cancer, lung cancer, colon cancer, the name doesn't give it away. It doesn't tell you what area of the body it affects. With cancer being so common, it is important to know background information on a variety of cancers. That's why I'm going to tell you about one, Hodgkin's lymphoma. I'm going to let you know what the definition is. What exactly is Hodgkin's lymphoma? Common symptoms, the staging and the prognosis of those stages, and treatment options along with their side effects. Hodgkin's lymphoma is a cancer of the lymphatic system. That doesn't tell you much. What is the lymphatic system? The lymphatic system is the biggest component of the immune system. Here in this picture is a picture of the immune system. It involves the lymph nodes, the thymus, the spleen, and the bone marrow as some of its major components. With that, it carries lymph through your system, which fights infection. When Hodgkin's lymphoma comes, it hinders your immune system and you're not able to fight infection. Hodgkin's lymphoma has 4 stages. Stage 1 only affects one area of your body and does not move. Stage 2 affects 2 areas of your body, but they're neighboring areas. They're not random areas throughout your body. They're side by side. Stage 3 affects areas of your body on the upper and lower half of your body. And stage 4 affects several areas of your body. It can be upper, lower, and either side. It does not have to be neighboring areas. And it also affects organs like the spleen and the thymus or other areas in the immune system. When you're diagnosed, you receive a stage and they also evaluate you on your symptoms. You're either symptomatic or asymptomatic. If you're asymptomatic, you do not display symptoms. If you're symptomatic, there are common symptoms that you may show. Some of these may be night sweats, constant fatigue, where you're always tired and it never goes away, weight loss when you're not trying to lose weight, loss of appetite, and swollen lymph nodes as shown in this picture. Here the lymph nodes are normal size and they do not touch. Here they look like a big clob of lymph nodes and they're discolored and you can often feel them from outside the skin. After diagnosed, they decide what you're going to get for treatment. This depends on multiple factors. The stage of the cancer being stage 1 through 4, the size of the tumor the cancer forms, the age of the patient, and whether you've shown symptoms or not. Normally, patients are treated with chemo and radiation, no matter what the stage is. However, the stage determines how much chemo and how much radiation you are going to receive. If a patient relapses or has stage 4 of the disease, they are often treated with a stem cell transplant. The hardest part of the disease is sometimes not the disease. It is the treatment for the disease. The treatment carries side effects. For chemotherapy, there are short-term side effects, such as nausea, vomiting, mouth sores, and most common of all, hair loss. However, those aren't the only side effects. There are also long-term side effects even after you've completed your treatment and are in remission. High toxicity from the cancer drugs can cause damage to your organs, such as your lungs. It can also cause infertility or form other cancers later. Other side effects from radiation, there are short-term and there are long-term. The short-term side effects of radiation are redness and irritation of the skin, hair loss at the site of the radiation, and the most common, fatigue. Long-term side effects of radiation can be tissue damage where you receive the radiation, heart disease, and of course other cancers can form later on. The survival rate for Hodgkin's lymphoma is very high, which is why some people say it's one of the best cancers to get. In this chart, I show the survival to death ratio. Out of 10,000 people diagnosed every year, 87% will survive. Only 13% will die. Even patients with stage 4 affecting several areas of their body have a 5-year survival rate of 90%. Although survival rates are high, patients need medical support and emotional support during and after diagnosis. Some people say it's the best cancer, but there is no such thing as the best cancer. Cancer is cancer. The earlier the disease is found, the lower the stage, and the higher the survival rate. The more likely you will be part of the 87%. Remember the symptoms such as night sweats and swollen lymph nodes. Don't ignore the warning signs and get checked frequently, as well as encouraging others to also get checked.